Right, back with you tonight on In Focus. At least 2,300 people have died from a suspected cholera outbreak in Nigeria. According to the Nigeria Center for Disease Control, over 69,000 suspected cholera infections have been recorded in 25 out of the 36 states, including the capital, Abuja. For more on this, I'm joined now by Paula De Beltran Gutierrez, who's the Health System Strengthening Manager at UNICEF. Paula, good to have you with us on In Focus tonight. What is behind the spike in cholera cases?
Hi, good night. As you know, cholera is an acute diarrheal disease caused by an infection of bacteria, Vibrio cholerae, causing vomiting and diarrhea that is usually spread through water and food. And although the infection is often mild and without symptoms, it can be severe and lead to death. Now, cholera is endemic in Nigeria and is usually spiked by poor sewage disposal, lack of proper environmental water and sanitation, and lack of hygiene practices and safe water and potable water. And cases occur in areas where contaminated water is used for irrigation, washing, cooking, and drinking. So in addition to these environmental factors such as flooding, which is currently happening in Nigeria due to the rainy season, has an impact on the transmission of the bacteria, and everything that affects the climate and flooding may spike the cholera outbreak.
Yeah. Is there a correlation between the cholera outbreak and the coronavirus outbreak, which also requires water and the washing of hands consistently?
Right. So, yeah, definitely not a correlation, but handling cholera amid the COVID-19 is a bit more challenging than in other years because resources are limited also in terms of testing and management and treatment of cases and dealing with the infection and control as you are mentioning. But the work that UNICEF is doing, especially with the communities in terms of providing safe water and improving safe hygiene practices, work together in both cholera and COVID-19 to control both diseases, especially providing disinfectants, chlorine for household water treatment, disinfection of homes, of latrines, and community water supplies that are safe and clearing all of these drainage systems and the solid waste disposal, especially in areas where the population is very dense. So it's a synergistic effect for both cholera and COVID-19 control.
Yeah. And what's the treatment and what's the, I suppose, the intervention for the control of cholera, and how difficult has it been now in the times of COVID-19?
So when, as mentioned, some cases are mild, but when you have an acute diarrheal disease caused for cholera, you need to respond with oral rehydration salts, with Ringer's lactator. This is intravenous fluid with zinc, so to contain that dehydration that is the cause of severe disease and death. And so the health system has been a bit strained in that regard because some supplies and the response of the health workforce and in terms of protective gear and managing that disease, it's a bit harder now with the COVID response also happening at the same time.
Yeah. How serious is the government of Nigeria taking this question of cholera in as far as improving their sanitation facilities for better and more hygienic practices?
So, the government of Nigeria is taking all measures to respond to the cholera outbreak, especially strengthening the coordination both for the response for COVID, for cholera, and also improving all the capacity of the health workforce in terms of managing testing and treating the disease. So, and actually, if we look at the latest data on surveillance, it looks like within this week, you can see the curve of the cholera outbreak starting to go down. So even though it's endemic, governments of Nigeria and other partners working on the sphere of the emergency response are putting all their efforts to control the outbreak amid this rainy season.
Yeah. Now, there are concerns that children between ages of 5 and 14 are the most affected age group when it comes to this particular health crisis, and the cases of fatality there could even be higher than those that we are seeing with the COVID-19 pandemic. Give us more details.
Right, and especially for us as UNICEF, this is an area of special concern because, as you're saying, children are more susceptible than adults to having a severe case of cholera, especially those under 5 and also under 14, but under 5. And in this group of children, also this is worsened by the presence of malnutrition, and especially in areas where there's a dense population, and especially in areas for displaced people. So this is one of the areas of UNICEF focus on the response.
And what sort of response then are you bringing into Nigeria?
So we have 3 lines of work, basically around the health component that would be strengthening both the coordination of the surveillance and the treatment and the management, but also, and very important for us, is the work that we do around water, sanitation, and hygiene, both in strengthening the availability of safe water and the environmental campaigns that we do with the communities, but also in introducing and teaching the communities on the safe practices they need to do with food, with hygiene in general, so as to break the spread of that outbreak and that transmission of cholera.
Yeah. I hope you can give us an answer to this. I mean, cholera quite endemic and seasonal in Africa, particularly in the most populous countries in Africa. How far are we as far as the Sustainable Development Goals and the sanitation targets that were set on the continent?
So in terms of this, both in the sanitation targets, well, I can speak about Nigeria mostly, not, I don't know the whole context for the region, but we are a bit lagging behind. But in terms of what we are doing about it is, in terms of the development partners and the government, is trying to accelerate all these interventions that will strengthen the health system in Nigeria, so as to build a sustainable health and water and sanitation system that can deal and be more responsive to this kind of aggressions and shocks to the system.
And what would the government of Nigeria then need to do or prioritize at this time?
Sorry, can you repeat?
I'm saying, what would the government of Nigeria need to do or prioritize at this time to be able to respond to those targets?
So I think the government of Nigeria is leading the response, for example, on COVID, and are putting a lot of efforts around this and maintaining, for example, the vaccination rates, even in the midst of all of this, and building on that leadership and that initiative on the response of COVID. They're also building on the response to other outbreaks, including cholera. So, but we have to be aware of the limited resources that are in country, and just as I mentioned before, try to look at those areas of synergy between the different outbreaks and epidemics that are happening, so that both components or any other emergency component can be strengthened. So being aware of the context is also very important.
We appreciate your time. Paula, thank you very much for coming through tonight. UNICEF's Health System Strengthening Manager, Paula De Beltran Gutierrez, there giving us more information on their intervention and the outbreak of cholera in